Canada just made express entry faster for doctors already working here, and people are asking one uncomfortable question.
Specifically for international doctors with at least 1 year of Canadian work experience.
So let me get this straight. If a foreign physician already has 1 year of Canadian medical work experience, Canada now wants to fast track them towards permanent residency. But what about the doctors who are already here? Thousands of them, citizens and permanent residents, who still cannot access residency positions or independent practice. Many of these doctors are working as clinical assistants, observers, associate physicians, clerical staff, and researchers, while waiting for years to enter the system. So who exactly benefits the most from this pathway? Because realistically, the people most likely to qualify are physicians already working inside the Canadian institutions, such as predominantly visa trainees, fellows, restricted licensed physicians, temporary foreign doctors. When the country already has thousands of Canadian doctors, why bring a batch of foreign citizens to fast track them into permanent residency? And here's where the conversation gets interesting.
How much does a single Saudi-sponsored visa trainee pay to the University of Toronto per year of training?
Sponsor pays us $100,000.
You have any idea how much the total amount is?
That's between $45 and $50 million.
Wow. Does the money that the University of Toronto collects from foreign-funded visa trainees go into the faculty's general revenue? Yes or no?
Yes and no.
Is there anything requiring the University of Toronto to use foreign visa trainee funding to expand medical training for Canadians?
No.
No?
No. No. The funding for the expansion of programs for Canadians is provided from the Ministry of Health. Or MCures. It doesn't go directly to the expansion of the programs. It supports all of the programs.
So it goes into general revenues and you decide where it goes and it doesn't go back into...
Not just specifically the expansion programs.
So it
is also used, so I'll give you an example. It is also used to support our Office of Learner Affairs.
Who would, it could go into artwork for the walls. It could go into anything into the university.
We take responsibility for the use of the funds, and I would be happy to provide you with what the expenses are.
Yes, that would be very good.
If a Saudi Arabian person can take that spot, what does it take for us to get an IMG in that same spot? Is it $100,000?
No, it's provincial funding.
I realize that. But
so it's
when
not
we see this
$100,000.
when we see this budget that has just been set out, how many extra spots are we going to create across Canada? And I'm thinking, well, 97 million could possibly create 1,000 more medical specialist graduates if we use the money correctly.
So obviously, critics are going to ask you some difficult questions about this. Is Canada building a physician's retention strategy or building a parallel pipeline that bypasses the internationally trained Canadian doctors already here in the country? And before anyone gets upset, this isn't about attacking immigrant doctors. This is about asking why Canadian citizens and permanent residents who are already trained physicians still face enormous barriers while the system creates faster pathways for others already inside the institutional pipelines. That's a debate nobody wants to have.